welcome and welcome back to my channel. My name is Tiza. That's if you're new here, and if you're new here, please subscribe, okay, and click on the notification bell so you get notified when I post content in the future. I will be delighted to have you as a part of this family. Today I'm going to be doing a feminine healthcare video. Hold on, just because I said feminine does not mean if you're a guy you should click off this video, because you have a sister, you have a mom, you have a woman, and whatever affects your woman directly affects you. So I'll be doing like the most common infection that plague females. That's what we're talking about today, which is BV and yeast infection. BV going for bacteria, vaginosis, and yeast infection. I will tell you, these two infections happen when bacteria gets into your vagina. But the difference between these two infections is BV is commonly seen with people who are very sexually active, people who are sexually active though. But yeast infection is not necessarily accustomed to sex. So that's the first thing. So we're talking about the causes of yeast infection. The first thing is scented products, because I see these days that people want to buy scented body washes. You want to smell like strawberry, you want to smell like chocolate, like roses, like peaches. You are allowed to smell the way you like, but your vagina does not actually like those scented products. So when you actually do that, it throws your normal pH balance off and you start to have yeast infection. Number two on scented products, they're scented condoms, because there are a whole lot of brands now, but flavors and scented condoms can actually give you yeast infection. Okay, you like those condoms that you like, those chocolate flavors and stuff like that. And if you're a lubricant girl, I would advise you, do not go for scented lubricant and do not go for oil-based lubricant. I'll tell you to go for like a water-based lubricant. And whenever you're buying something you are using for your body, I would advise that you use a product, a brand that is very, very honest with their ingredients, so you know what you're doing. Number two, I would say tight clothing. You put on tight underwear, you put on skinny jeans, your coochie is not breathing. So that's a place to like grow bacteria, because bacteria actually grows in moist, warm places. And we know, okay, we all know that our vag is always moist and it's very warm. So that's like a breathing space for bacteria. So sometimes just let your kidney breathe. Number three, I would say the abuse of antibiotics. You don't know this. You don't know this. Antibiotics actually throws your pH balance off. So when you start to abuse it, you start to take antibiotics without the doctor's prescription, or you just sick and you self-medicate. My sister, be very sure that you are not doing yourself any good, because you are going to treat what's wrong with you at the time and end up treating yeast infection. Number four, I will tell you the use of antiseptic. Antiseptic is supposed to be for like a cleaning agent. You clean your house, even if you want to use it for your body. Antiseptic is not meant to wash your coochie. I don't know who told you that, but they told you wrong. Please and please do not use antiseptic down there. Number five, I will tell you, putting things that do not belong into your vagina. I've heard people say garlic can cure infection, and you put garlic there for 2 days. Are you trying to grow that shit? You're trying to grow that garlic? I will tell you that don't put anything there. Anything that is not supposed to be there, do not put it there. And lastly, I will tell you, if you own any sex toy, being a dildo, vibrator, anything, make sure you always keep it clean. I know this TMI, okay? Keep it clean. Always make sure you keep it clean, because if it's dirty and you stick it into you, like bacteria is going to get into there and it's going to grow there. Now I'm going to talk about the symptoms of yeast infection, so you know when you have this thing. The first thing is cottage cheese discharge. The discharge kind of look like, you know, oats, I don't know, cottage cheese discharge. That's the first thing you will notice. Number two is irritation. I feel like this is the key. If you have yeast infection, this is the key. This is how you will know, like irritation. Number three is redness and swellness of the vagina. You swell during sex, after sex, you know, that's one of the things that you should know about. Number four, I will tell you, itching and burning. Itching being inside, outside, like you just itch everywhere, and that's one of the things. These are all like the symptoms you will actually see when you have a yeast infection. Now let's come to BV. Now, bacterial vaginosis is not an STI. Okay, so don't let anybody tell you nothing. Bacterial vaginosis is not STI. It's not like you get it from someone and you're transferring it to someone. It's like a bacteria gets into your body and grows there and give you that thing, and is now transferable. Do you understand? But I will tell you something, like Our vagina is acidic. I want you to understand this properly. Our vagina is acidic and sperm is actually alkaline. And alkaline and acid do not go together. So if you actually have a man that you are having unprotected sex with and is constantly ejaculating in you, the sperm in there will actually like throw your acidic vagina off its normal pH balance. So I'll give you something like, whenever you have sex, unprotected sex, I know you want to cuddle, okay, sis, I know you just want to be with your man, you just want to lay down there and get back, kisses, neck kisses, but get up, try to pee and wash off. This is like key. This is key if you don't want to have BV. Just get up, try to wash off, and actually try to pee. Then I'm going to tell you the symptoms of BV, how you know you have bacterial vaginosis. The very first thing is fishy smell. Like fishy smell. Your discharge has become like, the smell is now like very like obnoxious. Number 2 is watery discharge, white or grayish watery discharge. You just sit there and you find yourself like very wet, like it's almost like pee, but it has this fishy smell. And the last one is irritation. So if you find these 3 things, you know that, oh, I have bacterial vaginosis. Now, how do you treat these things? Because it's actually treatable. Don't let nobody tell you nothing, okay? Don't be ashamed. It's not a life-threatening infection, okay? Don't be ashamed. Don't let no one tell you anything. Actually go and see your doctor. That's the first thing. Do not self-medicate. Go and see a doctor, okay? When you get there, explain yourself, and if it's something that they have to run a test, probably they are not sure because of the symptoms that you have, you actually do like a test, maybe a swab and a urine test to know what is wrong with you. So you can do that first. Then they will prescribe drugs to you. And I'm going to tell you something, okay? This is why people treat infection and they come back to be like, oh, I treated it last month and I'm having it again this month. You start having reoccurring vaginal infection because whenever you're giving your medications, you do not take it judiciously. You just take it for like, your medication is supposed to be like 5 days, you take it for 2 days, you just see a visible difference and be like, oh, I'm good, and you just forget about it. So that bacteria is actually weak at the time, but it's going to come back, reinforce, and start again, and you'll be like, oh, I treated it last month and it came back this month. Number 2, the reason why people treat infections and it actually reoccurs again, if you are treating without your partner, okay, it takes 2 to tango. I'm having sex with you, I have to treat and you have to treat. So that's how it works. You have to treat with your partner. If you have multiple sex partner, you have to treat with all your partners, okay? That's one of the things. And lastly, I will tell you, I'm not a medical practitioner, so I cannot actually like recommend products for you, but I will tell you that take supplements for your coochie health. Cranberries, boric acid, prebiotic, probiotic, those things are good. Apple cider vinegar, they are good for your vaginal health. So you should actually see a doctor to tell the doctor, I want to start taking supplements for my vaginal health, and they will actually prescribe something to you. I hope I have been helpful with this video. And if I have been, please, you've watched to this place, you've watched to this very time, please do not forget to subscribe, share this video, okay, share to people, like this video, comment. I want you to tell me the things that you want me to talk more about, okay, and give my video a thumbs up. So I will see you in another video. Bye.